Low back pain can be a result of many different injuries, conditions, and diseases. But most often, an injury to the tendons and muscles of your back can cause this problem. Your pain can range from mild to very severe, and in some cases, it can be so severe that makes it really difficult for you to walk, work, sleep, or even do your everyday activities. Now, how can we find the main reason of our pain and the best treatment for it? Hello and welcome back to our channel. This is Dr. Fatima, and today we are going to talk about the causes and the treatments of lower back pain. So if you're interested, please stay tuned. Around 4 out of each 5 persons have experienced some levels of lower back pain at some point of their lives, and it is actually one of the most common causes that people go to visit a doctor. Now, what are the contributing factors to lower back pain? Why does some people feel more pain than the others? In 2019, a systematic review was published which evaluated the most important contributing factors to having lower back pain. This study showed that overweight, obesity, psychological distress, occupations which include activities that require heavy lifting, diseases such as osteoarthritis, and bad lifestyle habits such as smoking were the most important factors leading to lower back pain. We have 2 types of lower back pain, which are the acute and chronic lower back pain, and the prognosis and treatment for these two are different from one another. Acute back pain can last for a few days or a few weeks, but it is less than 12 weeks. The chronic back pain is defined as the pain that lasts for more than 12 weeks and it can recur. Most of the patients with acute lower back pain recover really quickly without any significant loss of function. Now, what are the potential painful sources of lower back? Let's check the lower back anatomy. Your lower back is the anatomic region between your lowest rib and the upper part of your buttock. Your spine in this region has a natural curve which is called lordosis. This curve helps your body to balance the weight of your head on top of your spine. The other parts of your lower back are vertebrae, muscles, ligaments, nerves, facet joints, and intervertebral discs. One of the primary causes of lower back pain can be disc herniation. The disc between our vertebrae is made of 2 layers. The first and the most inner is a gelatinous soft part called nucleus pulposus. The second and outer layer is a strong fibrous layer called annulus fibrosus. Because as we age, the nucleus pulposus that usually works as a cushion to distribute the load of weight will be unable to distribute the load. So this will lead to more load at the peripheral area, causing tears in the outer layer or the annulus fibrosus. This annular tear can cause lower back pain even without sciatica or radiculopathy, because the pain receptors are located at the outer annulus or on the posterior longitudinal ligament which is next to it. And this annular tear can be the beginning of disc herniation or degeneration. Another type of lower back pain is discogenic pain. In this type of pain, there is some changes in disc but not herniation, and the patient feels the pain mostly in the back but not the legs. Now let's go to treatment options for lower back pain. In general, when you have a history of a short-term activity-related lower back pain, the management would be physical therapy, reassurance, and painkillers. So there is no need for an X-ray or an MRI in early stages of lower back pain. There are studies that show that heat and cold therapies can be effective ways for treating lower back pain. Now, how should we know which of these heat or cold therapies should we use? Cold therapy is mostly used for the pains that comes on suddenly, such as an accident or a direct injury. This therapy can cause your blood vessels to constrict and reduce swelling and inflammation. For this treatment, you can use ice in a plastic or even frozen vegetables, but make sure that you wrap it nicely in a towel and make sure that you don't apply it for more than 15 minutes. That is because the prolonged and direct exposure of skin to these cold packs can lead to tissue damage. Heat therapy, on the other hand, can provide relief by improving blood circulation. Continuous low levels of heat therapy is one of the most effective ways to treat chronic lower back pain. You can use heat packs, hot water bottle, or even a heated towel, but just make sure that you don't overheat yourself. I've searched in Amazon and found some of these cold and heat packs that I think are easy to use. I've put the link to one of these products here so you can check it out for yourself and see if it suits you. Just please let me know in the comments if you found one specific type of these packs more convenient and effective. There are also some exercises suggested by physical therapists which can help you ease your pain. The first exercise is supine bridge, so you should lie on your back with your arms on the floor at your sides. Bend your knees and keep your feet flat on the floor. Tighten your abdomen and gluteus and slowly lift your hips off the floor while keeping your back straight. Then slowly lower your butt and hips back down to the floor. Do this for 10 times. The next exercise is called bird dog. In order to do this exercise, you should get down on your fours and put your hands on the floor exactly under your shoulders and your knees exactly under your hips. Keep your head in line with your spine and lift your right arm forward and your left leg straight behind you until they are both parallel to the floor. Pause, then return to the starting position. Repeat this exercise with the left arm and the right leg. Be sure to keep your abdominal muscles tight and your back flat through the exercise. Also, you should know that there are some red flags to lower back pain that in case they happen to you, you should see a doctor emergently. If your pain radiates to one of your legs and at the same time you experience some changes in your bladder and your bowel function, you should call your doctor right away, because these symptoms can be caused by a compression in the spinal cord or nerve compression. Also, if your pain persists for more than 1 week and if it is preventing you from doing your day-to-day activities, it is a good idea to see a doctor. At the end of this video, I should also mention that all the exercises and suggestions in this video should be done after consulting your personal doctor. That was it for today. Thank you guys for watching. I should also mention that we also have another video about sciatic pain for which the link is provided. Please don't forget to share, like, and subscribe. Bye!